we have been supporting the Ministry of Health with the 888 One Love hotline since we were first called in March of 2020 to support individuals that needed to understand more about the pandemic, more about the virus. We've had about 30 people supporting this program over the past 12 months. It has done well, and it's been an honor to serve the nation. It has also helped us in the height of the pandemic last year when the BPO industry was shut down for 14 days. And a lot of our travel-related clients also shut down, and we were able to keep people employed versus laying them off. So it was a big support for that as well. As an organization, we've been very proud, as I said before, to support the Ministry of Health. We have supported the ministry thus far in donation in the last 12 months of just over 100 million Jamaican dollars of services to this program. And it is an honor to continue to support it and to formalize a relationship for the next 12 months to continue to support the nation and the Ministry of Health. So thank you very much, Minister, and to you and your team at the Ministry of Health.
All right, thank you very much, Mr. Epstein. At this time, I'll ask our minister to make remarks as well.
Okay, so thank you very much, Stephen, our Director of Public Relations and Communications at the Ministry, Yanni Epstein, friend and professional Chief Executive Officer of Itel BPO, Directors of the Ministry of Health and Wellness who are here and online. Ladies and gentlemen, members of the media, first of all, let me apologize for the late start. Just running from one meeting to the next has been a challenge in the last couple of days. I want to, first of all, even before I get to the script, use the opportunity to really express on behalf of the Ministry of Health, the government of Jamaica, and indeed, I dare say the people of Jamaica, the contribution by Itel BPO and Yanni Epstein, whose leadership as a Jamaican has really demonstrated a sense of social consciousness and patriotism. Yanni is correct. He has been on board from day one as part of the COVID response, in that he has offered his BPO establishment, his resources, his equipment, his time and effort to supporting in so many ways the COVID response, from the calls that people wanted inquiries around to travel arrangements, information of one form or another. That 888 One Love number, which has been used so often, more often than not, it is because of Itel BPO and the leadership of Yanni Epstein and his team that has allowed us to manage the process efficiently. So I just want to put that aside. Outside of what we're going to do today, I really want to recognize you and your entity for the work that you have done. And it's an indication that all hands are indeed on deck in terms of trying to deal with this COVID-19 response. So I promise to come and visit you and to say thanks to your employees. I just want to put the record that I'm still committed to that, right? So let's organize that time. Beyond that, and forgive me if I take this off a little bit, we're still at a social distance, so we'll. This afternoon, we are, I think, executing a very important component of our vaccination implementation plan. And it's something that persons have been asking about. I get calls every day. When am I going to set my appointment? How will that arrangement go? Who do I call? And while we have been careful to say to persons, it's not that time yet in the process, we were dealing with healthcare workers, police, JDF, very targeted groups. We know where they are. We have their database. We didn't need to create a mechanism for mass inquiries, if you will. Until now, persons have understandably been anxious and wanted to know or get information on when their time will be and how they can make contact to arrange their appointments. So earlier this week, we signed the agreement with UNICEF, really software platform, which will allow persons to register online and to provide information, two-way information, so that clarity can be brought to the appointment process and the follow-up process. And so that is in train, and in another few weeks, week or so, you will see that up and running, and persons who are technologically savvy can access the appointment process through that means, no matter where in Jamaica you are. Today, we are adding to that by developing or officially signing, I should say, the arrangements with Itel BPO, where Itel BPO now will be the other leg of the process of setting appointments by calling a line, a toll-free line, 888 One Love. So we're moving then to expand the various ways in which members of the public, based on the phased implementation, now is the time, it wasn't before now, it is now, will be able to register and book an appointment to be inoculated at a convenient site across the country. The ministry is moving toward the implementation of the comprehensive vaccine administration platform, where in very short order, persons will be able to make appointments and know when they will be able to receive their vaccination, which is key. So, you know, don't give us a little time. It is playing out according to plan. That's the point I want to make. A key component of persons being able to be vaccinated in a timely and efficient manner is the use of technology to manage the registration process at the vaccination sites across the island. To support this comprehensive vaccine administration platform, we're engaging in a contract with Itel BPO, led by, of course, Yanni Epstein, which will see our target groups being able to call our 888 One Love, that's 888 One Love number, and make any appointment to be vaccinated. This registration option will become available on Monday, March 22nd, 2021. So let me say again, Monday, March 22nd, that's next Monday coming. Not today, not tomorrow, not Sunday, Monday, March 22nd, 2021. You can begin to call the 888 One Love number. It should be active then.
In the group.
And
Based on your group.
sorry?
Based on your group.
Based on your particular group, exactly. Thank you very much. Not everybody. So Monday, I believe we start with the 75 and overs. So if you're 75 years old and over, if your mother is 75 years old and over, your father, your uncle, your brother, and you want to help them, if you don't think they're listening, we ask the media to help us with that. Come Monday, you call this number and you will get, on the other end, a response. Now, I'm going to ask Yanni when I'm finished to explain how the BPO service works, because to be totally frank, government does have a reputation for ringing numbers and no one answering. I've gotten umpteens of complaints about that. And one of the reasons why we have chosen to outsource that component of this technology platform for making appointments is because we are going for the best technology and the best expertise to train people. So even though you have one number, and sorry to sound simplistic, but I think it's important to explain, that number allows multiple persons to call and multiple persons on the other end of the line to answer. So the fact that you call that one number and 10 or 15 or 30 other people are calling that one number, Yanni, there are dozens of other people on the other end, and that number will be triggered into some sort of switchboard network system, and someone will answer with all the information. They'll ask you what parish you're calling from, which health center you go, all the things that are going to be necessary. So they set the appointment for the place that is most convenient, where you belong, where you should be, maybe a health center where you are already visiting, it's your health center or a hospital, so that you're not going to get an appointment for St. Mary if you live in Westmoreland. It's not going to happen. So a very important part of this service is convenience, call from any part of the country, whether a landline, your cell phone, it's free, there's no charge. Someone picks up on the other end, multiple persons are manning it, and they will ask you some simple questions, and they will give you basic responses right through to the end of the process. And I'm saying to Steve as a communications head, we're going to have to explain that in a very detailed way, but simple steps so that persons know what to expect, know what the questions are likely to be. So if they have to have anything on hand before the questions are asked, those things are on hand. But I just want to say to the public, come Monday, March 22nd, starting with 75 years and older, right across the length and breadth of Jamaica, who wish to take the vaccine, that 8881 love number will allow you to make an appointment for a venue closest and most convenient to you. And the team manning that will be Yanni Epstein. So if you're not getting through, don't come to me, ask him. No, no, I'm sure he will make sure that it works. Now we have a big BPO industry in Jamaica. What's the latest? What's the numbers now that you employ overall?
About 37,000.
37,000 Jamaicans work in BPO. And these are persons who serve companies all over the world. North America, a main place, and Canada, but all over. So someone in Connecticut who calls there to book a vacation or to inquire about a product they bought, and the phone rings in Montego Bay or in Kingston, and it is the Jamaicans who are providing all the information. I am emphasizing the point to say that we are very capable and able, and will work hard to ensure that the number is easily accessible and the responses are swift and you get your appointment. So our vaccination implementation plan, which has been operationalized for a week now, and within the first 7 days, we have seen some 94% of the target we had set for 1 week, which means we are just short 6 percentage points of what the overall numbers we have set, which I think is very good. And I want to use the opportunity to commend the team, the healthcare workers, the permanent secretary, the CMO, the parish managers, the vaccination or immunization team led by Dr. Ennis, because we set targets, we established the centers, and it has worked. And that is why I say we mustn't be too hard on ourselves, despite the fact that we have had some hiccups. To man 60 plus centers, and 1 or 2 have had some difficulties resulting in shutdowns, is not an indication of failure. It's a learning experience, and it means that for the overwhelming majority of time, it has been successful. The team did well, and whenever there was a problem, we solved the problem. So we shouldn't condemn the process because we have had some margins of error. And I, frankly speaking, say the same should apply for even the management of our vials and the doses. We have administered over, I'm told, up to date, nearly 1,700 vials, each with 10 doses. And if that is the case, we will have some waste. That's not desirable. That's not what we want. We will work on it to prevent it as best as possible. But for the overwhelming majority of times, I think the system has worked. And the audit that is in the system, which is automatically triggered periodically, does show up where we have these inefficiencies. And it also means the system works and we correct as we go along. And I certainly would hope that we recognize the efforts of those who have made it while we correct the challenges that we face. So we are now at 34% of our target for the month and just 1% of target for the year. So we still have a long ways to go, but we are partnering with our partners here and abroad to ensure that we receive the 4 million doses of vaccines that we are trying to secure for the 65% of the population that we would like to inoculate by now and March 2022. We do expect some new supplies in early April, and we're hoping that it will get better as time goes by, as we overcome some of the global shortages that exist, so that we can carry through so that when you call that number or apply online or visit that health center, depending on your targeted group, you will always have vaccines, and vaccines will be there with the nurses and the doctors to apply to you. So on behalf of the government, through the Ministry of Health and Wellness, I welcome this agreement with Itel BPO. This is yet another very important aspect of the rollout of the vaccination plan. The operations will be guided. This is of the BPO support by the World Health Organization's protocols around how we manage a process such as this one. And we will have checks and balances to validate the data that gives us the information to assess, to ensure that we protect the public's health and the confidentiality issues. All of that will be based on standard protocols around immunization and standard protocols around patient rights and for their personal information. So thank you again. And again, I wondered if Yoni would just spend maybe 2 or 3 minutes just to explain how the BPO space works, because it may be a good opportunity just to get persons to appreciate that. And
Sure. Thank you again, Minister. So basically what we do, as we've been managing this for a year now, we have a lot of data to determine the amount of calls. So based on the amount of calls that we received over the past 12 months and the amount of calls we project we will continue to receive, we then man the phones with individuals. So as you had said, the 888 One Love number, based upon the projected amount of calls, we determine how much concurrent phone lines we need. So as you said, you call, if their agents are busy, it'll keep you on hold. You won't get a busy signal. You'll be kept on hold and passed on to the next available agent that will be able to assist you. Based upon the certain service level agreements that we have with the ministry, we will continue to add individuals if the volume is greater than what we had predicted initially. So that will allow us to continue to maintain those service levels, assist the individuals on the phones that are calling in. And as you said, we'll ask certain specific, simple questions to fill out the questionnaire provided by the ministry so that the information can be given back to the individual as to what time and where to go for your vaccines. As well, we'll continue to support individuals that are calling as to where they may need to go to get tested, as well as support individuals that are coming into Jamaica, whether that be Jamaican nationals or foreign nationals, as to how to fill out information on the Jam COVID website to be able to get your approval to land in Jamaica. It has been, as I said, an honor. We have helped individuals who have called just to talk to somebody as they've been working through, recovering from the virus at home. And it has really, really, I think, worked well. And as long as we're calling the 888 One Love number, you will get a voice at the end of the line. I know there's many different numbers between ministries and agencies and offices, but if you're calling specifically for this situation, dial 888 One Love, and you will get a voice at the end of the telephone.
Thank you very much. So there you have it, ladies and gentlemen, members of the media. So Monday, the 22nd of March, we will begin to take calls on the 888 One Love number, manned by the BPO entity, Itel BPO, and those targeted groups would be 75 years and older, general population. But of course, we will continue to do the police officers, if they are still there, the healthcare workers, if they're still there. And I believe we will eventually move into parish councillors and so on next week. So you will still see the priorities that we started with, to the extent that we need to complete that. What we're doing now is adding additional, and this would represent the first group that would be considered general population based on an age cohort. And of course, those are the most vulnerable if you look at vulnerability generally. So Monday, March 22nd, 888 One Love. Thank you very much. You doing any questions?
Right. We're going to actually sign the contracts now.
Okay.
Back page.
Go straight to the back? Okay. All right. All right, ready? Okay. Yes, sir. All right. Thank you, sir. All right, lovely, excellent.
All right, as you said before, Minister, that they have supported us from last year. So we want to make a special presentation to them. So I'll ask you.
All right. As well know about that. Oh, lovely. Excellent. Actually, I did. I signed it.
Yeah.
Well deserved. Very well deserved. Thanks again. Thank you.
All right, so we'll invite our media colleagues if they have any questions. We can take a question or two quickly on the Zoom platform. You can use the raise hand feature if you have any questions for Minister or Mr. Epstein. I think everybody's crystal clear.
Oh, okay.
So we are good
All
to go.
right.
Thank you so much. Thank you, Minister. And thank you, Mr. Epstein, and enjoy the rest of the afternoon, everyone.
Thank you very
Thank
much.
you.
Coronavirus is in Jamaica, and I know you feel scared and worried. But you can't let COVID-19 divide us. Coronavirus infects all kinds of people. It doesn't discriminate. So why should you? When someone coughs or sneezes or shows signs of the virus, tell them to call 888-1-LOVE immediately. And remember, stay 6 feet away.